Hello, everyone, and welcome to the American Canadian School of Medicine's webinar on the Strategic Medical School Pathway, what pre-med students need to know about ACSOM. Thank you so much for taking the time out of your busy schedules to join us and learn a little bit more about your pathways to medicine, about finding the right fit for you, and all that you need to know about ACSOM, but as well as next steps towards finding your medical education and starting that journey for yourself. So my name is Christine. I am the Canadian Enrollment Coordinator here at ACSOM. I am located in a small town outside of the GTA called Peterborough, Ontario. Please feel free to drop in the chat where you are from, where you're joining tonight, as well as where you're at in your medical school journey. On my end, I know it's -30 here where I live, so hopefully it's warmer where you are and you are joining from the comforts of your home. And I'll toss it over to my colleague who will be joining us tonight and chatting a little bit more about her experience at ACSOM. So feel free to introduce yourself.
Hi, everybody. Welcome once again. My name is Yana Seaman. I am a first year medical student here at ACSOM, and I am from the beautiful island of Dominica, where you would be if you decided to come and join us here at ACSOM. If you have any questions, I am here to answer, and I hope this informational will do you justice in, deciding and understanding what it is taking these steps.
Awesome. I'm seeing some other Ontario folks in the chat, so stay warm, everyone. Yeah, so we'll get started and just, if you have any questions, as Yana mentioned, please feel free to put them in the comment section on the side and we'll address them live, or if they're personal, we can kind of type the answer out, whichever you prefer, and we'll have a Q&A at the end of the session, sorry, but we'll also be answering questions as we go through. So, sorry, let's see. There we go. So I know that a lot of students are kind of weighing their options right now, and it's important to acknowledge that everyone is coming from different backgrounds and they've got different plans for their medical school journey. And it's a harsh reality. In the US, in Canada, the students are facing kind of a difficult time. The seats are limited, the competition is high, and it can feel a little discouraging. And that's why we want to kind of have the conversation about why studying internationally is a strategic and smart move at this point in time in your education, to allow you to have all the information to plan ahead and to make a decision that is the right decision for you and for your family moving forward. So when it really comes down to being a physician, the question isn't where you start, it's how well you're prepared. And I think there's a little bit of a stigma about where you go to medical school or what your credentials are. But if you have all of the examinations and the credentials needed to be a physician, you deserve to be there. So it doesn't matter where you went to medical school, it's how well you are prepared for the journey of being a physician, for working in a hospital, and for taking care of patients. If folks want to put in the chat kind of why they are looking at ACSOM, maybe it's the desire to study in a beautiful location like Dominica, again, a warm, beautiful place that's not -30. That would be my kind of that'd be a driving force for me. But maybe you are applying to schools in your home country as well as international schools at the same time. So I'd love to know where students are at in their journey. Or if you're just exploring all options, to keep all options open. I think there's no wrong pathway to medicine. So I want to chat a little bit more about why this conversation matters today and why we're chatting about the strategic choice. So medical school seats remain limited in the US, in Canada. Applicant pools continue to grow with qualified applicants. And now our students are seeking international alternatives. I see in Canada, for example, oh, I froze. Yana, can you still hear me? Okay, perfect. In Canada, we see static med school seats, so seats that aren't adjusting with the need of our population. There are high GPA and MCAT thresholds in Canada. In the US, there are growing applicant pools with no proportional increase in seats. So this ultimately leaves many qualified students without options, such as yourself. So that's why students are seeking alternate pathways internationally. And that's why schools like ACSOM exist, because the current system as it stands cannot absorb all of the qualified students like yourselves into the current system. So this isn't about settling. It's not about backup plans. It's about having a strategy. Many strong candidates don't secure a seat simply because of capacity issues. It has nothing to do with your credentials. So the goal today is just to discuss a little bit further how you qualified students can navigate this reality really thoughtfully and hopefully leave with a plan and feel empowered to make the next decision and the next step in your education. So I'll chat a little bit about why ACSOM was built, and it follows kind of what we've all been talking about, which is it was founded to address gaps in traditional Caribbean models. So obviously we know that there are many qualified students that do have to leave and do have to seek international options just because of the limited seats in their home countries. And we realize that the Caribbean has changed and the medical schools have changed, but not all of them. So we were designed with student outcomes, support, and transparency in mind, and we were built by experienced US medical educators. So it's really important when you're looking internationally and in the Caribbean to do your research, to see what works best for you and what you want out of your education. There can be a wide variety of and a wide variation in curriculum quality across medical schools, differences in accreditations and costs across the Caribbean, and student support matters ultimately more than location. So you might love the location of a school, but if they're not going to offer you the education or the support that you need, that's really something that needs to be taken into consideration. So I really encourage you to do your research. And this is why ACSOM was created. In this photo, we actually have Dr. Bagapur, known affectionately by our students as Dr. B, and he's the founder of the school. He created ACSOM. You know, he designed it by physicians for future physicians to make sure that if you weren't able, and in Canada, if you weren't, as I say to our students, if you're not lucky enough to be one of the few students chosen to go to a medical school in Canada or in the US, that you're not disadvantaged at all. You are still getting the same curriculum that you would get in North America. You are still getting the same quality of support, of care that you would get in a US or Canadian medical school. You are being part of a school that was designed intentionally from the ground up to create well-rounded, caring, and excellently trained physicians ready to practice wherever you choose. As I mentioned, it's the same curriculum and the same learning that you'd get in North American curriculums, and you will not be disadvantaged because you weren't one of the folks to get into the US or Canadian medical schools. And I think that's really, really important, is that you will not be negatively impacted at all if you're not able to practice in your home country. Our faculty comes from Yale, Penn State, University of Western Ontario, University of Calgary in Canada. So there is a deliberate focus on student success and preparation. And we'll get into that kind of as we go through the webinar. We are also a not-for-profit institution, which makes our main goal is to make the education more affordable and accessible for students. So to reduce some of those barriers associated with medical school, especially in the Caribbean. Our only goal, we're not here to turn a profit off of our students' backs. Our only goal is to create well-rounded, caring physicians. And when we accept students, we do everything in our power to see them through to the end stage of becoming a physician. We don't want to lose students. We support them throughout the entire journey. And Iana will be able to kind of chat a little bit more about what student support and what life on campus looks like. So that's a little bit of a background on why ACSOM came to be, was to address these gaps that were existing in North America and to make sure that students did not have to suffer if they didn't practice in their home, or if they didn't study in their home countries, you would still get the same quality of education and training that's needed to get a residency in Canada or the US or wherever you're looking to practice. Because I know we have folks joining from around the world as well tonight. So a little bit more about learning at ACSOM. I'll actually let Iana, I'll kind of go over it a little bit, but then I'll let Iana kind of walk through what a day looks like as a student. So our curriculum is case-based, and that's by design. So everything at ACSOM is taught in a clinical context in small group case-based learning. So your classes are capped at about 10 students. So you can really kind of have that small group feel. It's a flipped classroom approach. So while you are led by physician tutors, you are driving the conversations and you are driving the discussions. But you will always, everything is through the lens of a real clinical context so that you are able to immediately take what you learned in the classroom and apply it into a real world setting. Our faculty are practicing physicians who are trained to teach in this small group learning. And they are also very accessible to students because you are only in a class of 10. You're not, in a huge lecture hall of thousands of students fighting for time and attention. It is carefully and thoughtfully built into the curriculum that you will have this time with your to get your questions answered, and they can adapt really quickly to learning strategies. If they can see that a student is struggling in a certain module, they can jump in for that early intervention. Emphasis in our curriculum is placed on problem solving and critical thinking rather than a traditional lecture-based approach where memorization is very, very heavy. We focus more on the critical thinking and on the practicality of the medical curriculum. So I'll actually let Yana kind of chat about what a day looks like with our case-based curriculum.
Sure. Okay. So our days typically start off in the morning around 8 if we do have guest lecturers on the island. We will have a guest lecturer give a talk or a presentation on their particular specialty. We've had people from many different backgrounds: nephrology, cardiology. We've had nurse midwives, nurses themselves, and other people who have visited the island to just give us a bit of perspective into what those specialties are like and how your life would be like essentially if you were to go into those roles. From 9, we have small group, and with small group, essentially what we cover are is our pre-work. And so what they will do is on Canvas, they will put in cases that we look over, and it will be essentially what we call a vignette where they tell you about the patient and um, what ailments they might be having, their stats, so their temperature, their blood pressure, and all this. And essentially, we're supposed to, as a group, come together and figure out what particular pathology that patient has. So we come together, we figure that out, and then we have a full on discussion about the topics that surround that particular patient. So we'll discuss, okay, how does that person get to this point? Why, like, what about physiology will, if it were to go wrong, essentially, how would you get to that type of pathology? And then at the end, typically we have a group quiz that we do together. And so we'll go through questions typically from UWorld, which is a learning platform that many students use. It's excellent. I love it personally. And we'll go around the room doing questions. But what I love most about the way that we do things is that you read the question and you can know the answer, but our professors love asking why. So it is not as simple as answering this is the why, like this is the answer to the question, but why is this the answer to the question? Why are the other answers not the answers to the question? So it gives you an opportunity to test your critical thinking in the sense that you don't just look for the right answer. You're not just training yourself to look for the right answer, you're training yourself to understand what the correct answer is and why other answers are wrong. And I think that that has truly helped us as students to be fully engulfed in the learning style because it's so direct and it's so intentional in the way that they teach us that it creates an environment where we're not just thinking about what's in front of us. You're thinking about it from a 360 point of view, which is really nice. Um, On Fridays, we typically have formative assessments. These aren't graded. However, it is just kind of like a benchmark to gauge how well we've understood the material from the week, what things that we need to go over, things that we might be able to put to the side for a little while we focus on other things. And then we rinse and repeat, and we do that Monday through Friday. Um, and then, of course, during the week, we also have anatomy lab where we go in and we have lectures based on whatever system we're learning at the time. And then we also have ICM, which is a course where we learn how to do clinical medicine, which is really nice because you get to put into practice the things that you learned in class and see how you would go about figuring out what might be a patient's concern based on what you've learned. So you use your skills that you learn in class in a very practical setting to understand the topics very well. I think I think I covered everything. I think that's
Yeah,
it.
do you want to just chat a little bit? You brought up kind of the module or the system. Do you want to chat about how those modules work instead of being
Sure.
traditional lectures, like how our curriculum is kind of structured that way?
Yes, of course. So in every semester, there are three modules that you go through, and they are system based. So, for example, right now I am in my second semester and I am currently doing cardiology and hematology. And so the entire 7 weeks is focused on those two particular topics. Right now, we're kind of transitioning more into cardiology and finishing up his hematology. And so we do those, and at the end, you have a summative assessment of everything that you've learned in those 7 weeks, and based on that, then you progress on to the following module. And this is done in a way so that you can understand the systems, but the way that it's structured is that each system kind of builds on each other because we know, yes, there are individual systems and they all have their jobs, but they also depend heavily on each other. So after cardiology, we'll do renal pulmonology, so you understand how your circulation will affect your kidneys and your lungs. So that's kind of the model that we have for class. And so it's kind of centered around understanding each system and how they relate to each other. There you go.
Perfect. Thank you. Yeah, that's great. Thank you so much. And here's just some kind of example, some photos of actual our small group learning. When we say that it's interactive and clinically focused and truly capped at a small group, this is what it looks like. These are kind of what your classrooms are going to look like and some of the group work. And what I love about ACSOM is kind of the cohort feeling as well. Like you want to support the folks in your small group because if they do well, you do well. The better their learning and understanding and comprehension, the more you're able to learn and comprehend. So it's kind of like um, you're working together versus against each other. So I think that that's a really great showcase of what the curriculum is, but also the cohort and the type of students we have on the island. Here's just another, you know, another photo of, I think it's very similar to the room that you're in right now. Yeah. So another thing about ACSOM is that we're preparing students for success from day one. So we have early clinical thinking, as Iana just kind of outlined with our ICMs and putting everything into that clinical context. It's not just early exposure. So we have the case-based learning from the start. Clinical context is integrated into all of your basic sciences, into all of your modules and your systems approach. And you're really preparing for real patient encounters. It's not about rushing students into hospitals unprepared. It's about context. Students can directly and immediately understand why they're learning the material and why and how it applies clinically, which improves overall, I would say, confidence in your ability. And we also work within the local community. So we give, there's diabetes education, there's stroke awareness, there's vaccine administration. So we're able to kind of take those skills and contribute to the society and give back to the island that gives us so much. But it also allows us to put us in that medical education context and strengthen those skills. So I'll chat a little bit more about how ACSOM supports residency preparation. again, as we're talking about the strategic pathway to medicine, it's about getting you where you want to go. And for some folks, that's practicing abroad. For some folks, that's coming back to the US or coming back to Canada. So this is how we widely support our students. So all of our assessments are USMLE aligned. So those kind of capstone, there's the benchmark exams, but then there's also the final exams that will allow you to pass on to the next module. Those are NBME questions that will prepare you for your USMLE. So you're getting that built in to every single module. We have structured academic support. So you have your physician tutor that's in your classes with you, but then we also have support services on the island to help you academically. If you need kind of a little extra help with some of the concepts that you're going through, we have that structured academic support. There's early advising and mentorship. As I mentioned, your peer physician tutor can do that in early intervention if they can see that you're struggling with a certain area and help strengthen and foster that. And then another way that we're supporting residency in Canada is we're in very late stage negotiations for securing Canadian clerkships. So I'll go a little bit more into detail on those. So we integrate preparation into the curriculum, with each module being concluded with an NBME questions that prepare you for your STEP exams, or in the Canadian context, the MCCQE1 exams. This is better than leaving you to self-direct, because you always have those benchmarks of how you're performing on these types of kind of standardized tests. Students can, it just helps keep you on track. Sorry, I got lost in my little notes. And for our Canadian residency students, these late stage negotiations for the Canadian clerkships will help strengthen your residency preparation, because you are practicing so our US students can do their clerkships in the US, our Dominican students can go through the US, that's the traditional channel. Canadian students now will have the option. They can practice and do their clinical clerkships in the US, or they'll have the option to do it in Canada as well, which supports their residency preparation, because you'll be learning in that Canadian clinical setting. You'll be building your network in Canada. And the MCCQE1 and the NAC exams, yes, they test your knowledge, which you'll be kind of testing yourself throughout those exams, but then they also test your clinical knowledge. So you'll be able to have that Canadian clinical knowledge because you just spent the last 2 years in a Canadian healthcare setting. So that's another way that we're preparing you. And no other international medical school is pursuing this pathway for students to allow you to do both your core and elective rotations in Canadian hospitals, which is what we're really proud of. And because we're a not-for-profit, and because we've got strong connections here in Canada, we're able to pursue those pathways and have conversations that other folks can't. And we also have pathway to residency resources. So, you need to be registering for your accounts with the MCC or with your the US residency match by this time. You need to be securing your letters of recommendation by this time. You need to be making sure you're scheduled for your exams by this time. So we help support you throughout those pathways as well. Anything else you'd like to add on that notion, Iana? Like the kind of the preparation for like the USMLE, for example?
Yes, of course. So as I mentioned before, we do the questions in class, but what I really love is the fact that we do NBME questions for our exams, because it gives you a sense of what sitting for a step is like. It is in a standardized testing center with like the same dry erase markers, and everything is set up in that way so that it can resemble, and you'll get accustomed to that type of environment, so you don't feel intimidated going into taking an exam like that. And I think that's very important as well, because testing anxiety is very real. And that can sometimes affect students who are highly intelligent and know exactly what to do. However, being under that level of stress can be difficult. So, us being able to be in an environment where we can learn how to relax, breathe for a second, and understand it's just a test. You've learned everything that you need to know. Is definitely a stepping stone that we love here at Axon.
That's awesome. Thank you. And just leaning a little bit more into like the clinical rotations and professional development. we have as I mentioned, we have a structured U.S. clinical rotation network with clerkship hospitals in the Desert Regional Medical Center in Palm Springs, California, as well as in Pennsylvania, Philadelphia, sorry, which is in Pennsylvania. But yes, it's in Philadelphia as the city and like the hospital network there. So we have students that are in both Palm Springs and Philadelphia doing their clerkship rotations right now. We have support during your transitions into clinical years. And we focus not just on, getting you those clerkships, but how you behave and your professionalism within these clerkships. So our Dean of Academics, our founder, our academic team, they really want to emphasize professionalism in the workplace. They want you to be confident presenting your cases. They want you to be an active member of your team. And I think that that's built in throughout the curriculum. And the way we build the curriculum has given our students such confidence and ability to be standing next to their U.S. medical school trained students and peers and excel. So I'll give an example. We have our one of our students, Lenore. She's at DRMC right now, and she was in her second week of her second rotation, which was surgery. And we teach our students digital anatomy. So we look more at scans and ultrasounds and MRIs, more of what you would see when you're in the hospital versus kind of traditional cadaveric. You don't ever want to, look at a liver when it's been passed away. That's not going to be good for your learning. So we do it as you would see it as it's presented in the hospital. So our students are very used to that type of learning, and they're used to diagnosing and working with that type of digital anatomy. So a case came across and they were asking the clerks, and Lenore knew right away. She could see it in the scan and she knew what it was. And everyone was like, how did you know that already? Like we're still figuring out how to read scans. And she says, well, this is how I was taught anatomy. So I know it. I know what to look for. I know exactly kind of the area of the small intestine that this is. So that gave Lenore more confidence in her ability and in her training. And she was able to speak up and to advocate for herself. And one day she was working with the surgeons, and she asked to scrub in on a surgery. And there she was in her second week of her surgical rotation, and she was holding a surgical tool in the room of a brain surgery, assisting on it, just because she asked, just because she had trained and she felt confident in her abilities. And the students were actually, the doctors were saying that the ACSOM clerks were performing a little bit more like first-year residents with their ability to participate and to present their cases. And that's really why and how our curriculum was designed. There's no, the doctors couldn't tell who came from which school. They could just tell who was prepared and who was well trained. And so, the surgeons were actually telling Lenore that she should consider matching in surgery. So we'll see how that ends up. She loved it. I can see her doing it, but we'll see how her other rotations go. But I think it's just an indication of how much emphasis we put on not only that clinical training, but also that professionalism, advocating for yourself and your skills. And by the end of your 4 years, Dr. Baggerpour really wants our students to have their case, published case studies. So he encouraged Lenore to write that out about what she did on that case and publish it. So this all just strengthens kind of your residency applications and how you look to in the match. And so there's a question about Canadian med schools. Do we have affiliations with? So we actually don't have affiliations with the med schools because that's just a different structure in Canada. It would be affiliations with actual hospital units. So it would be the core and elective rotations at a set of hospital units in Ontario is where we're looking. We haven't signed the agreements yet, so we're not sharing which hospitals they are, but hopefully by the end of this spring, we'll be able to announce, and the clerkships are set to start, hopefully if everything goes as planned, in August of 2026. So our next cohort of students will be able to start their clerkships in Canada and have the option. Some students still, Palm Springs, Clerkship. I wouldn't hate spending a few years there being from Canada. So you have the choice. But I think if you are someone who's keen on coming back home, practicing where you want to, doing your clerkship where you want to eventually do your residency, I think really strengthens your network, your understanding of that healthcare system, and will only make you a stronger applicant when it comes time. Okay. So when you're making your decisions and you're looking ahead at, what medical school feels the right fit for you, I really encourage you to do the research. So do exactly what you're doing right now. Attend webinars, reach out to admissions advisors, see the campus if you can. Get all the information because, there are lots of variations in medical school and what medical schools offer. If you like a big lecture hall and that's how you like to learn, um, then that's maybe what you should be looking at. If you don't want to be just a number in a large lecture hall and you want to be really in control of your own learning in a small group environment, then ACSOM really has the curriculum and the education for you. So it's all about what works for you. But to thrive in medical school and to thrive at ACSOM, you have to be self-motivated and passionate about what you're studying. You have to be resilient and adaptable, and you have to be committed to growth and feedback because, as I mentioned, this is not a backdoor to medical school. This is not a backup plan. We have a very difficult and rigid curriculum. We are training physicians and we are training good physicians. So you will be asked to be at the highest caliber of your learning. You will spend a lot of your time studying. You're in medical school. You'll be training to become a doctor. And so you have to be able to be committed to it and put the work in.
Kind of to piggyback off of what you're saying, um, yes, the curriculum is difficult. However, I want you to keep in mind that our professors, our facilitators, they have that expectation of us because they do believe that we have the capabilities to perform to the level that they expect. And so being at Axon creates that relationship with your superiors as well, I believe, so that you understand that yes, these people have learned the things that I have learned, but it's okay for me to ask them questions. I should not be afraid to ask questions. I should not be afraid to be involved in the discussions that we have in class. And I know that I can say from my personal experience because I attended, even though I am from Dominica, I did attend undergraduate in New Orleans, Louisiana. I see somebody in the chat from New Orleans. Um, and I also did apply to US medical schools. Ultimately, my decision came down to whether or not I wanted to be closer to home because I did spend about 10 years in the US. So my reason for coming to the Caribbean for medical school was a little different. However, I did know that I was not a student that performed well when I was in classes that were more than 50 students. I did not perform well when my professor had no idea who I was, even though I went to their office hours multiple times because they just have so many people that they have to care for and they have to instruct that it can be difficult to develop that relationship. But I can tell you, as somebody who likes that kind of learning experience, it is nice to walk in a hall and every professor or every facilitator, even no matter if they've taught me or not, can say, "Hi, Yana. It's nice to see you today. How is your day going?" It's very nice to have that kind of relationship because you feel seen, yes, as a person, but you also are able to get actively involved without feeling like you're just a number. So I just wanted to add that little tidbit.
No, that's exactly it. And that's what I was the students that I think engage with the system, the way we have it. Like if you are, active in your classrooms, if you speak with your professors, if you really buy in, those are the students that perform the best. And I think that just kind of goes with what you're saying. We do have a more rigorous admissions process than some of the other Caribbean schools. And that's to your point, like we know you deserve to be there. So all we're asking you to do is to perform at the level we know you can. Because as my colleague, Dr. Padmos, who was the former CEO of the Royal College of Physicians and Surgeons here in Canada, he says that a GPA can only get you so far in medical school. The rest comes down to your personal characteristics, to your resiliency, your time management, your dedication. That's what takes you the rest of the way. So I think that's important to remember that if you have a great MCAT and a great GPA, that's wonderful. That'll get you in the door. But you and your personality and your personal commitment to medical school will keep you there. So that's who I think thrives at ACSOM. And probably in medical school in general, but I think that it's always important to remember because I think in Canada and the US, so much emphasis is put on your grades and your metrics, whereas that is not the only thing that makes a great physician. Your experiences, your caretaking abilities, your empathy, your compassion, that's what makes you a great physician. And that's what we also seek to foster at ACSOM. So we heard a little bit from Iana kind of throughout, but I'm just wondering, she told us a little bit about her journey, but maybe if folks in the chat have any specific questions for Iana, we can get into that, or we can kind of continue on and just chat as it goes. But if there's anything else, Iana, that you'd like to share that maybe we haven't had the opportunity to touch on, feel free to do, maybe about community life at ACSOM, things that you do, and you know, all the free time that you might have.
Okay, so not too much free time because we do have a lot of studying to get done, but we do also have extracurricular activities that students are allowed, of course, to participate in every Friday after a formative assessment. After that very long, hard week, we play volleyball out. The good thing is that here in Dominica, it's nice and warm outside, even though it's January, about to be February. So every Friday we go out, we play volleyball together. Even if you don't play volleyball, we sit out there on the field and we just talk and hang out. We have events that are hosted by student ambassadors like myself, and the student government organization who hosts movie nights, game nights, and other things that you can get involved in. Of course, there are so many different clubs. For example, I am the president of, well, the incoming president of the OBGYN Interest Club. There's the Internal Medicine Interest Club, the Surgical Interest Club, humanities and medicine, who are doing extraordinary things in their commitment to improving the community surrounding ACSOM. So they go out into the Portsmouth area to do community service projects, which I believe is a really great initiative. And different fundraisers and stuff. So they do candygrams during um, Thanksgiving and Valentine's Day, to raise money for their organization and the work that they do, which is really nice. Um, there's research opportunities. There are professors from various walks of the medical field, which is also really nice to have options as to, okay, I have an interest in this, but I'm not really sure. Have a discussion with that professor, and then you can do research with them to strengthen your understanding of that particular topic and to kind of see if you want to go into that specialty at some point. And I think, I mean, there are other things, of course, but I can't really think of any right now.
Awesome. Thank you so much. So I'll just get into, this kind of goes back into like the student that thrives. Oops. Got some duplicate slides in there. Yeah, so for those of you, I know you're kind of coming from different journeys in your application cycle. Some of you may have already applied. I know there's some folks here that have already secured their deposit and are set to come in August, which we're really excited. We can't wait to meet you. But if for those of you who are still kind of in their decision-making journey, you're closer than you think. You can start your application for August now if you're thinking about kind of applying to international schools alongside medical schools in the US or Canada. We're seeing more and more, you know, when I first started, we were seeing students that were a little bit older, kind of had gone through a few cycles of the North American system before deciding to go internationally. Now it's really changing. The conversation is changing and students are applying to us at the same time as other medical schools and then making the decision as it comes. So we've had students that have turned down DO offers in the US to come to ACSOM because they resonated with the curriculum a little bit more. So again, it's just great to have kind of a full picture of the options available to you. So for us, there's no application fee, so you know it's an accessible application. We have scholarships that are available for all of our students, and they're there at the time of application. So there's no additional applications forms that you have to fill out. We assess you kind of holistically, and then from there we assess scholarships. We have very easy uploads for your application, so you can apply using your AMCAS, your ACOMAS, your OMSAS. You can use the ACSOM application and just send your transcripts. So we do have some admissions requirements of undergraduate degrees, 2 semesters of biology, 2 semesters of chemistry, 1 organic chem and 1 biochem, sorry, math and physics. So those are our admissions requirements. We do also ask for the MCAT. And we have our August 2026 class that is open. So you were able to apply now and start in August. And then we also have an MD Direct program. So if you have some of the prerequisites, but not all of them, or if you don't have the MCAT and you have no interest in taking the MCAT, we have our MD Direct program, which is a 19-week long program that prepares you for medical school, and successful completion of that gives you automatic acceptance into our MD program. So those are just some of our applications. And so this is how to apply. You can apply online. There will be a link at the end of the presentation. Then you submit your, you get it. We assess you based off of your criteria, and then you go through to the admissions interview, which is probably the most important part because that shows us who you are, what kind of physician you'll be. And then you await your decision. We try to be really, really quick with admissions decisions because we know that you are, often looking in multiple areas, and we want you to have that decision in hand so that you can, make a decision that works best for you. And then you accept your offer and prepare for your day one on the island. So if you have more questions about ACSOM, about the admissions process, about what the next steps are, please feel free to book an appointment. This is a QR code that will take you to our booking page. I do the Canadian admissions, but I also talk to a lot of US and international students all the time. So I'm happy to meet with anyone and everyone. But we've got our director of recruitment, we've got some admissions advisors that are happy to meet with you. So we'd love to kind of keep this conversation going. And that kind of brings us to the end of the formal presentation. So if you have any questions, please continue to drop them in the chat and we will go from there. Here's a link to the application. And then I think we are having a lot of fun on social media. So please feel free to follow us on Instagram. We're very active on LinkedIn, and that's where you can see a lot more of our webinar content, our the great thing that our students are doing on the island and their clerkships. So LinkedIn's a great place to follow us. And then Instagram, we have fun with Instagram. So please feel free to connect. But yes, that's the end of a kind of our formal presentation. So I see some questions in the chat that we can kind of just go through. ACSOM has been operating. We are in our third year. So our students just began their clinical clerkships. We have our August class that has been in their clerkships for half a semester, and then our January students just started their clerkships this January. So we're really excited. This was our first clerkship year with our Philadelphia site. So we have some Canadians and some US students in the Philadelphia site. So we're very excited about that. And then the new residency 1-year gap rule in Canada affect IMGs. So I know that there has been a change in the Ontario kind of IMG ruling where you had to do your high school, 2 years of your high school in Ontario to be considered in the first round of the match. But there are still provinces in Canada that you don't have to have done your high school in Canada to be eligible for the match. So BC, some of the prairie provinces, and I believe Quebec. But in Ontario, Alberta, and our maritime provinces, so Nova Scotia, Newfoundland, and PEI, New Brunswick, those have that rule. So it might just change where you're able to match the first round in Canada, but then all provinces you'd be eligible for the second iteration. So that was a new rule, I think late last year. We're not thrilled about it, but that's kind of what the provincial government has just implemented. So if you are in Canada and you have come from an international background, I really encourage you to look at the residency requirements for each specific province that you are hoping to match in, because that might change where you're eligible. So I know in Alberta, for example, they changed their 1-year gap requirement, where you used to, if you did an international medical degree, you had to wait for a full year, but now you no longer have to do that. So that's been changed as well. So these rules are kind of ebbing and flowing because the physician shortage is so bad in Canada. We need more physicians. So I just encourage you to kind of stay on top of that and see. Oh, that's great. Thank you, Zahid. I'm glad to hear that it's been that the high school rule has been put on hold for now. But yes, the 1-year gap rule I know has been recently overturned in Alberta. So again, just take a peek with the Medical Council of Canada and the CARMS website are really, really great resources for outlining the specific pathways from where you are to where you want to go. So if you're a Canadian who studied abroad, what that looks like matching into each of these different provincial licensing bodies. So I can definitely share that resource with you after this webinar. Sorry, I feel like this was kind of Canadian focused today. There's lots of Canadian folks in the webinar, which is great. That makes me happy. The more, as a Canadian, the more physicians we have back home, the better. We got a new family doctor in my region, and it was in the newspaper. So that just goes to show how limited we are here. So for our first years, it's changing. So we are trying to grow very strategically every semester. So in our last August class, we had 50 students that we enrolled. And then in our January class, it's a little bit smaller at about 30 students. And then this August, we're hoping to enroll about 100 students. So, grow because we keep our classes so small, and because we have our physicians that are leading those, we have to kind of plan ahead. So we're planning for 100 students for our August 2026 cohort, and we are 80% of the way there. So don't sit on this opportunity, because seats are limited, and we're really excited about having almost doubling the size of our school in one cohort. So it'll be great, I think. And then, we'll continue to grow as the years pass, but we want to do it very strategically as to not, overwhelm or make sure, there are students that fall through the cracks. I'll go back just to the application page if anyone is interested. And I'll put what I'll do is I'll also put my email in the chat for folks. So if you have any, so if you're eating dinner after this and you're like, oh shoot, I forgot to ask this question, you can feel free to email me. I'm also a gateway to a ton of other resources. So if you want to ever chat with some of our wonderful student ambassadors who I think do the best job of communicating what it's really like to be an ACSOM student, I can send you the booking link. If you're curious about finances, we can connect you with financial aid. Our Dean of Academics has actually talked to students who were just curious a little bit more about the curriculum. My boss is the former CEO of the CARMS match, Sandra. So I connect her with students who want to know about what that pathway back to Canada looks like. So there are lots of resources that if I can't help you or answer the question for you, I will definitely point you to someone who can. Okay, well, I know Iona's in a study room right now, and I know that there's, there's something in the back there that she's been working on. So if there's no more questions, I'm gonna say goodnight and let Iona get back to her hard work and let you all get back to your busy lives. I really appreciate you all taking the time out of your days to spend it with us and to learn a little bit more about the American Canadian School of Medicine and how we can be the right fit for you and the strategic choice for your medical education. Please don't hesitate to reach out if you have any questions, if you'd like to chat further. There's no question that's too big or too small. I also do pre-assessments. So if you're in maybe your third year or your fourth year and you want to take a year off, send me your transcript and I can do a pre-assessment to let you know where you would fall in the application process. So it has been wonderful spending this evening with you. To my Canadians and to some of my Americans that are in colder climates, stay warm, and to Iona, just enjoy the sun for those of us who can't. Okay, take care everyone. Have a great night. Thanks, Iona.